Pet therapy. Here are a couple of fun facts about cats and dogs. Dogs have about 100 different facial expressions, most of them made with the ears. Cats have 5 toes on each front paw, but only 4 toes on each back paw. A dog's memory lasts no more than 5 minutes. A cat's can last as long as 16 hours, exceeding even that of monkeys and orangutans. Pet therapy, also called assisted animal therapy or AAT, is not typically considered to be a traditional relaxation or coping technique, but pets play a greater role in both our emotional and physical health than most people realize. Benefits. Touching and interacting with animals can actually help lower a person's blood pressure and provide stress relief. Research has shown that people with pets have longer lifespans. And people with pets suffer from less depression. One researcher found that people with pets had lower blood pressure and lower blood fat levels than those without pets, even though the two groups were alike in their diet and exercise habits. Pet therapy has been shown to reduce loneliness in residents of long-term care facilities. Studies report that children who live in homes in which a pet is considered a member of the family are more empathetic than children in homes without pets. Heart attack victims with pets live longer. In a study conducted at a hospital in New York, it was found that heart patients who owned pets were significantly more likely to be alive a year after they were discharged from the hospital than those who didn't own pets. A study conducted at UCLA found that dog owners required much less medical care for stress-induced aches and pains than non-dog owners. Pet therapy has been shown to help people manage symptoms of schizophrenia, PTSD, major depression, and problems with anxiety, which is why many psychologists often recommend their clients obtain a pet as part of their mental health treatment. Or they might prescribe structured weekly sessions with a trained therapeutic animal, such as a horse, dolphins, or a dog. WAGS program. There's a program in Colorado called the Therapy Dog Program, also known as the WAGS team, Wonderful Animals Giving Support. They've taken dogs on rounds through North Colorado Medical Center, NCMC, to visit patients. The director of volunteers for NCMC said that they let the handler and the dogs decide where they want to go. Some dogs prefer pediatrics. Some dogs prefer oncology. The handlers will often ask nurses if they have a particular patient that they'd like the dog to visit. Sometimes a doctor may order a therapy dog visit for one of their patients because of the calming effect the animals have on the patients. There was one patient who couldn't speak after having a stroke. The dog went in and snuggled up with the patient, and believe it or not, as the patient started petting the dog, the patient said everything is going to be okay after not having been able to speak since the stroke. The director said that you can sit and watch heart rate monitors drop down when a patient is petting a dog. Also, she said when she wanted to start the program 12 years ago, she thought she would have a tough time convincing the hospital that it was a worthwhile program. But the program was received with open arms and has become so successful that the hospital has more patients wanting visits from the therapy dogs than they can provide. So pets reduce stress, reduce anxiety, lower blood pressure, and boost the immune system. Now to that list can be added help patients suffering from post-traumatic stress disorder or PTSD. Soldiers obviously suffer as a result of the horrors of war, and many have received help in the form of counseling, medication, and partnering with other military veterans. But the healing process for PTSD has continued to be prolonged and difficult. This may help explain why some doctors are enthusiastic about the positive results they're seeing with the relatively new treatment of PTSD through animal-assisted therapy. Dogs can be trained to interact proactively, so when a patient is exhibiting high stress or anxiety, dogs are conditioned to come alongside and give the patient a gentle poke. Often simply having a calm animal nearby when the patient feels threatened acts to soothe their fears. In one study, psychologists noted an 82% reduction in symptoms with the use of dogs. One particular case noted that interacting with the dog for as little as 1 week enabled patients to decrease the amount of anxiety and sleep medications by half. The supplemental video for this lecture is Therapy Dogs Used to Relieve Stress and is just over 2 minutes. Listen to what some college students say about dog therapy at the University of Toronto. Key point: interacting with an animal can help calm a person and has been associated with several benefits. So if you have a pet, spend some quality time with your pet as both a coping and relaxation technique during stressful times. And that's it for this lecture.